we'd like to go ahead and begin. Many apologies for the delay. We are trying to do a live webcast of this entire event in both audio and video, and so it does take some time. We appreciate your patience in letting us begin a little late. And we're very thankful that you're here. First of all, I'd like to welcome you personally. My name is Norman Horn, and I help lead the Libertarian Longhorns here at the University of Texas at Austin. And we are helping sponsor this event, which is a vaccine education forum. You're here to listen to a debate from both sides of the argument because we believe in our group and in all the groups that co-sponsor us, who I'll mention in a moment, that to be fair and balanced, we do need to hear both sides. And so we're glad that you're here to participate in this, and we will have an opportunity later on to ask some of your own questions. And we do encourage you to make sure that even if your emotions get a little high, to make sure you remain civil and be fair and balanced ourselves. Because, again, if we expect our people up here to be fair and balanced, and we expect you to be fair and balanced as well. I'd like to give a little credit to our other organizations that are helping sponsor this. Like I said, the Libertarian Longhorns have been very helpful to me in assisting in organizing this event, but we also are proud to welcome the Objectivism Society, and Alan McKendry is in the back here. He's been one of our contacts. We thank them. The Health Professions Council has also been instrumental in making this event happen, and also the College Republicans. And so as you can see already, this is not a one-sided deal by any means, but also we're including many different points of view. I'd also like to acknowledge Texans for Accountable Government for being here as well. We're thankful that they're with us. And so with that, I would like to introduce our moderator for this evening, Dr. Donna Campbell, who will be directing us in the debate. Donna?
Thank you. Good evening, ladies and gentlemen. I'm Dr. Donna Campbell. I'm a physician. I'm boarded in both ophthalmology and emergency medicine, and I'm the medical director at 2 emergency departments. Like most people, I'm concerned about the future of our health care, our public health care policies, and I am concerned about the impact it has on our daily life. I'm excited to moderate tonight's vaccine education forum, which will debate the question, are vaccine mandates good or bad for public health? As you know, recently, the Secretary of Health and Human Resources, as well as President Obama, have declared the H1N1 virus as a public health emergency. These actions actually invoke law that could lead to mandatory vaccinations of the general public. While vaccines have been credited truly for eradicating many deadly diseases, there are several organizations across the United States that have successfully sued or are suing state and federal government in order to prevent forcible vaccinations on the grounds that the vaccine has not had adequate testing for safety. Tonight, we will debate these and other relative issues that revolve around this important public health policy. Once again, we are very grateful for the University of Texas sponsors, which include the Libertarian Longhorns, the Health Professional Council, the Texas College Republicans, and the UT Objectivism Society. And thank you all very much. Joining us are panelists, Dr. Tom Betz. He is the Regional Director of the Texas Department of Health Services, Region 7, and he is speaking in support of vaccine mandates. Speaking in opposition to the vaccine mandates are Dr. Sherry Tenpenny. She is the founder of OsteoMed 2, which is an interactive medicine clinic located in Cleveland, Ohio. She has many other credits to her long list of things she's done, but I'll leave it at that. Dawn Richardson is president and co-founder of PROVE. This is a group that stands for Parents Requesting Open Vaccine Education, and it's here in Austin. She's also the director of state advocacy for the National Vaccine Information Center in Vienna, Virginia. We did try to have a balanced panel, but despite our best efforts, we were only able to find 2 panelists on the side opposing mandates and one that is for mandates. Still, we will have a balanced debate, allowing both sides to rebut the issues. In our first hour, the panelists will be allowed to first introduce themselves and express their position on the issues. This will be followed by 2 question and answer periods. The first period lasts about an hour, and I will be directing questions that I've selected to each panelist. They'll each answer for about 3 minutes, and there will be a 1-minute rebuttal. In the second hour, that's your turn. We'll have you line up in the aisles. We will ask you to give your questions. You will have 1 minute to ask your question. The panel, whoever you direct the question to, whichever panelist, they will have 3 minutes to answer your question, and there will be, again, a rebuttal of 1 minute. Now, let's get to know our panelists. You each, again, have 4 minutes to introduce yourself. Why don't I start with you, Dr. Tenpenny?
Thank you. Thank you for the introduction. Is that all okay? And good evening, and thank you all for coming. And thank you all for all of the people who organized this for bringing me down from Cleveland, Ohio tonight to be able to participate in this really wonderful opportunity. I'm a physician in Cleveland, Ohio. I'm board certified in emergency medicine through 2005. I'm board certified in manual osteopathic medicine. I have a clinic in Cleveland that's been there almost 14 years. I got involved in the vaccine information awareness movement back in September of 2000 after attending the Vaccine Information Center meeting in Washington, D.C. And since that time, I've personally spent nearly 9,000 hours of personal research. I've written 2 books, put together 2 DVDs, and I've spoken at a lot of meetings like this across the country. I'm probably one of the few physicians who spent an awful lot of time researching problems associated with vaccines and bringing it to the forefront so that people like you and people who are watching this can choose for themselves and have a very open dialogue about informed consent and know the other side. So I want to thank you for this opportunity to openly discuss the pros and cons of vaccination in this forum. To my knowledge, this has only been done once before, and it was a radio program right here in Texas. Mm-hmm. Young people today are smart and savvy. If you were born between 1978 and 2000, your social group is now being called the millennials. Millennials as a group are politically, socially, philosophically independent. Your group will lead the sweeping change needed in America and around the world. Your group will make your own decisions about getting vaccinated and allowing your children to be vaccinated. You're not going to take the word of a bunch of baby boomers. You will Google it if you haven't done so already, and you'll figure it out for yourself. In 1985, there were 3 vaccines, and children received a total of 33 vaccine antigens when they got all the shots before entering kindergarten. But if a child is born today and receives every recommended dose of every vaccine, the child will receive 113 vaccine antigens and measurable amounts of chemicals by the time they start school. It doesn't take a master's degree or a PhD to understand things have changed, and so has the health of the children in America. As young, responsible adults, will you continue to believe the safe and effective mantra about vaccines once it is widely understood that safety studies are short and effectiveness has little or nothing to do with protection from illness? Will you conclude that suppressing outbreaks of chickenpox with vaccines is worth creating an epidemic of shingles in older adults? Will you agree that suppressing outbreaks of measles is a fair exchange for an epidemic of chronic illness and autism? Will you conclude that there are healthier, more natural ways to keep healthy during the winter instead of getting a flu shot? It's been demonstrated that health is an inside-out phenomenon. If we have adequate vitamin D and vitamin C, if we eat good food, drink purified alkaline water, get some exercise, and get plenty of sleep, The world of viruses and bacteria that we swim in will leave us alone. As a board-certified physician, I've invested more than 9,000 hours into the down and dirty about vaccines. I've come away with a studied opinion, not just a personal opinion, but a studied opinion that vaccines are not safe, not nearly as safe as we've been led to believe. They offer little or no protection, and they can cause serious harm.
30 seconds.
So thank you for this evening. I hope that you enjoy the exchange, and I look forward to your feedback on my Facebook page at drtenpenny.com, and I really look forward to your questions when it's the second part of this presentation.
Thank you, Dr. Tenpenny. Okay. I will just briefly caution you, a clap is very supportive in its own. All right. Dr. Betz, please.
I'm sure that was just a Texas welcome.
That's right. You might hold the mic a little bit closer.
Okay. I'm Dr. Tom Betz. I'm, as Donna said, I'm a regional medical director just up the road in Campbell, but I'm part of the Texas Department of Health, or now the Texas Department of State Health Services system. I should preface this by pointing out that the state of Texas, unlike the Commonwealth of New York, does not have a mandate for mandatory H1N1 vaccination here. So we can talk about mandates for school-age vaccinations, which we do have in Texas. And I can understand or present some of the rationale for the commissioner in New York, I think Dr. Baines. I guess I take a little bit different tack. How many of you in here have actually had a seasonal flu vaccine? This year. And how about the H1N1 vaccine? Okay, how about the H1N1 vaccine?
Right up to your mouth. Can't hear you.
Okay, how about the H1N1 vaccine? Okay. I have a couple of partners in crime back there. John Huss, who's the Deputy Regional Director. Diane Ramos, who's our immunization program manager for the region. Across from them is Priscilla Hargraves, who's the director of the Hays County Personal Health Department, and then next to her is Rebecca Herring, who's the TB and epi nurse there for them. So there's a couple of public health people, or four of them at least, in this audience. In looking around the room, I don't see too many people who were born before 1950, but if you could go back in time, that was an era where I was growing up where what are now vaccine preventable diseases were causing considerable death and disability. By the age 15, virtually everybody had been infected with measles virus, and 1 out of 1,000 would die of that infection. There were about 20,000 cases of paralytic polio each year. There were several 100,000 cases of pertussis, and there used to be a vaccine preventable disease, Haemophilus influenza B, that we hardly even see anymore because of vaccine. You don't have to go back in time. All you have to do is go around the world and see what's happening in some of the third world countries. And before the recent push to vaccinate Africa against measles, back in, I think, 2002, they had over 300,000 deaths from measles over in Africa. We've not had a death in this country from measles since 1993 at least, and I don't think we've had a case since then. So what I would advocate... Is that yellow?
30 seconds.
Huh?
30 seconds.
So I think for those of us who work in public health, and I've been doing this for 3 decades now, I don't know how many hours that makes, but for 30 years of working in public health, I think our biggest success has been the prevention of vaccine preventable diseases. So I'll try to advocate for that, and I've got the red card, so I'm going to...
Thank you. Dawn Richardson, Miss Richardson.
Hi there. Can you hear me okay? My name's Dawn Richardson. I live here in Austin, Texas. When I was pregnant with my first daughter, I started to have some questions about vaccines. My mom had sent me my baby book, and on the page where it says health history, it listed 2 serious vaccine reactions, one to the smallpox vaccine and one to the measles vaccine. I was shocked. We had never talked about this when I was growing up. I didn't know. It took until I was 6 months pregnant, sitting on my couch with my stomach in the way and the book out here looking. And so I called my mom and we started talking. And she told me about what had happened, how sick I had been. So I wanted to research this naturally. So I found a national organization through a referral from the State Health Department. And there was a woman here in Austin. And we took some time to go down to the morgue in Austin and actually pull out death records. And what I saw astounded me. I saw deaths of infants, little babies, clustering at 2, 4, and 6 months. I was an engineering graduate. I worked at IBM designing microprocessors. And I knew from statistics that if vaccines were not related, then these wouldn't be clustering at the 2, 4, and 6 months. They'd be evenly distributed. But that wasn't the case. It got me starting to read, and I read and used my engineering mind to go through and ask questions, to look at the risks of the vaccine and the risks of the disease, and just to try and make an educated decision for my child. But I was very frustrated to learn that Texas didn't have a way for parents to make that choice. There was a very restrictive law for you had to claim that you belonged to some bizarre religion that was opposed to vaccinations, and I didn't know of one of those, but I just wanted to be really careful that my child didn't have the same reactions that I did. So started going down to the legislature, and it took 7 years of going down there, but myself with a bunch of other moms and dads, got a law passed in Texas where you can fill out as a college student or as a student or as a child in daycare, you can fill out an exemption and pick and choose which vaccines you think are safe or necessary for your child. So with that, before I get into too much later on, I want to explain to y'all how a vaccine mandate comes about. First of all, the FDA, everybody knows the Food and Drug Administration, they seek approval for the vaccine, or the drug companies that's making the vaccine seeks approval from the FDA. Then, once the vaccine is approved, the Advisory Committee on Immunization Practices makes a written recommendation for the use of the new vaccine. The members of this group called ACIP are selected by the presidentially appointed Secretary of the U.S. Department of Health and Human Services. Next, the Centers for Disease Control, they go ahead and publish this recommendation in their publication called MMWR. Then, our state health department automatically incorporates the CDC recommendations into state rules and requirements, and all our children are required by force of law to be vaccinated for daycare, for just having them at home under the regular state requirements, and for school and higher education. There's some limited exemptions, but they don't apply to all situations. So what's important to note here about this process, did you ever hear anybody that I mentioned that's actually elected or accountable to you, the voters? No. They're all bureaucrats. They're all unelected and unaccountable to you. I'll illustrate what happened with the chickenpox vaccine. On March 17, 1995, the FDA grants the license to Merck to make the vaccine. In July of 96, ACIP recommended it. By August of 1999, the State Health Department went ahead and mandated chickenpox. So for the whole process, no elected official touched this. Even if you happen to be an advocate for this vaccine, the process by which unelected bureaucrats will make a vaccine mandate, it's not safe, it's not good for parents, it's not good for kids. We need to be in control of those choices.
Thank you, Ms. Richardson. Thank you. During this portion of the debate, I will now ask the panelists 9 questions, and they have had access to the questions in advance. Following these, there will be 3 surprise questions that they have not had access to. The panelists to whom the question is directed will have 3 minutes to answer the question, followed by a rebuttal. Of course, Dr. Betz has the opportunity to rebut either Dr. Tenpenny or Ms. Richardson's response, and they, in turn, one of them will choose to respond to Dr. Betz. So, let's go to our first question. Dr. Betz, What's the most compelling evidence for the effectiveness of vaccines?
Again, as I pointed out, if you were born back in the 40s or 50s, you would find that the impact of vaccine-preventable diseases on your life now has changed considerably, and that many of these diseases are no longer
Try it again.
are no longer a significant public health problem. Probably there's only, in the history of mankind, there's only been one actual disease that's been eradicated, and that was smallpox. In 3 millennia of human records, that has been probably the scourge and caused more death and disability than any other problem, including war and famine and all the rest. And in the 20th century, over 500 million people worldwide died of smallpox. With a concerted effort back with the CDC and World Health Organization, I wouldn't say that they're necessarily bureaucrats, because these were people running around in the field, and I know some of them. But with a concerted effort, the last case of smallpox was reported in Somalia in 1977, and the WHO declared this infection eradicated in 1978. So we've actually got to the point where we've eradicated a vaccine-preventable disease. We hope within the next decade that measles and polio will follow. This is due completely to intense and extended vaccination efforts, and I think the evidence is compelling as to the effectiveness of vaccines. As I pointed out earlier, back in the 80s we developed a vaccine for Haemophilus influenza B. That disease is now so rare that it's not even a reportable condition in Texas anymore. So as we eliminate some of these other vaccines, vaccine-preventable diseases from our population in the United States, we do develop other vaccines. So we do have several new vaccines that have come on since the 1980s. So, but the fact that none of us here are suffering from measles or smallpox or Haemophilus influenza B, polio, I think is compelling evidence that these vaccines work.
Thank you, Dr. Betz. Who would like to rebut? Okay, Dr. Tenpenny.
Thank you. Effectiveness of vaccines is generally measured as a reduction of the incidence rate of childhood infections or just the global population. However, low infection rates and high vaccination rates should not be the only measure of public health. And the public health effectiveness of vaccines should also take into consideration the impact on mortality rate and are children healthier today because of all the vaccines. It's known from the CDC's literature that less than 10% of the global population was actually vaccinated with the smallpox vaccine. And Dr. Tom Mack, who was actually part of the eradication program, actually said at a presentation at the CDC where I presented in 2002 that he said that smallpox was well on its way out anyway, it just would have taken a little bit longer. Most childhood illnesses are short and inconvenient, and exchanging them for a lifetime of illness and drugs may not be a good trade-off. The death rate from measles was less than 3 per 10 million in 1955 when the measles vaccine was introduced in 1963. Another thing that's really important is that effective is not a synonym for protection. And I think that when we hear that vaccines are effective, that's what we think, and those are not synonyms.
Thank you, Dr. Tenpenny. The next question actually goes to you, Dr. Tenpenny. What assurances does the public have regarding the safety of vaccines?
Well, I personally think that the public has little to hang their hat on about the safety of vaccines, with the exception of listening to what the pharmaceutical industry has said about that. When you actually look up the Webster's dictionary definition of the word safe, it says free from risk, harmless. And I think that when people hear the little saying, safe and effective, that's one of the things that they generally believe, that the vaccines are free from risk and harmless. However, if you look up the Webster's medical dictionary of the definition of safe, It says having a low incidence of adverse reactions and significant side effects when adequate instructions are given, having a low potential for harm under conditions of widespread availability, which I think is a little bit different than saying that they are free from risk and harmless. And this is one of the reasons why I think in vaccine research that the population studies are extraordinarily large, so that if several hundred people are considered to have bad side effects, that is not considered to be statistically significant, and that the risk still falls within the definition of what the medical dictionary calls as safe. So when a vaccine is promoted to the public as safe, it's trying to get people to believe that it's harmless and has a low probability of harm. The other thing about safety is that observation for side effects is only somewhere between 5 and 21 days. I think that it takes a lot longer than that for many side effects and complications of vaccines to show up, but that date has been arbitrarily set by the FDA and drug companies many years ago. Testing is done in foreign countries on vaccines for safety, and those persons have different genetics, eat different foods, live in different environmental conditions. Testing is only done on healthy babies and healthy adults, but when it's approved for use, it is generically given to everyone of all conditions across in all societies. There's very little safety studies that are cut off because they're short. Epidemiology never proves or disproves anything, and I think that we forget that a lot in statistics. Epidemiology, at best, serves for a guide for deciphering an approach that is most likely to generate results, and that's a definition that comes from an epidemiology journal. So it cannot prove anything. So using statistics to define safety is not the same thing as using science to define safety.
Thank you, Dr. Tenpenny. Dr. Betz, would you like to rebut?
Yes, I guess it hurts a bit because I was state epidemiologist for Texas for some time, and actually we think we can do some things with epidemiology. It's basically the science of public health. I don't think anybody in either the vaccine production or public health sector really intends to imply that vaccines are always completely safe. There's always, with any medication, there's always some risk of side effects in that. With vaccines, we try to keep them to a minimum. The CDC has created a vaccine adverse event reporting system that does not have any time limits. It's not affiliated with any drug companies. Part of the problem we have with drug companies is they're very reticent to even develop a lot of these vaccines because it's not a very profitable endeavor for them. So without all of that, I think I'll stop.
Thank you, Dr. Betz. The next question goes to Ms. Richardson. Let me ask you, do vaccine mandates enhance or endanger public health? What's your opinion on that?
Before we determine the effects of vaccine mandates on public health, we need to agree on what the definition of public health really is. Public health is the wellness of a community as a whole. The problem with many who work in the public health field today is that they often have a myopic fixation on making sure everyone gets vaccinated rather than concentrating their efforts and resources on making sure everyone is actually healthy. Public health is far more than just high vaccination rates and low infectious disease rates. It is about a community of truly healthy individuals. Under the traditional medical paradigm of one-size-fits-all mass vaccination, children today receive up to 49 doses of 14 different viral and bacterial vaccines before age 6, making American children the most highly vaccinated children in the entire world. Unfortunately, our children are also among the most chronically ill and disabled as well. It is for this distinction that those in the public health field should receive a big fat F for failure. Today, the Centers for Disease Control admits that 1 American child in 6 is developmentally delayed. I said 1 in 6. Straight from the CDC. In the past 25 years, the number of American children with learning disabilities, ADHD, asthma, and diabetes has more than tripled. Autism increases range from 200% to over 500% in some states. In the same 25 years, the number of doses of vaccines that pediatricians give American children have more than doubled. And this is the age range from birth age 6 that these kids, their brains and immune systems are developing at the most rapid rate. These statistics very clearly show that the current system of public health is not working. It is broken and in desperate need of repair. There is growing evidence and a groundswell of scientists, doctors, and parents who believe that overzealous vaccination policies fueled by vaccine mandates have contributed to these increases. A mandate is not just an endorsement by the government. It carries with it the force of law. The problem with this is all vaccines are different and all children are different, and they'll react differently. In contrast, there's no shortage of public health officials who mislead parents by exaggerating the risks of the diseases and either deny or hide the real risks of the vaccines, and they get away with it because of the mandate. It is becoming clear why a growing number of educated parents around the country are working to institute informed consent provisions and exemptions in their state law.
30 seconds.
Vaccination is a medical procedure that does carry the risk of injury and death. It can be far more dangerous for some people than others. Every person deserves to be given truthful, unbiased information about diseases and vaccines and be allowed to make informed voluntary vaccination decisions for themselves and their children with no penalty of law that vaccine mandates impose.
Thank you. Dr. Betz? Dr. Betz, do you have a rebuttal?
Yes. In the case of school-age vaccination mandates, if you wait for people to just voluntarily go ahead and get vaccinated, we never get rates above about 45%, maybe 50%. And for that reason, the only way we've been effective in eliminating measles, polio, Haemophilus influenza B, mumps, rubella, and these vaccine-preventable diseases has been through mandatory school requirements. Otherwise, if you don't get high enough vaccination rates, then you can't really stop the spread of disease. In a similar way, if you look at, we had to pass seatbelt legislation in Texas because even though seatbelts were in cars since 1968, only 20% of the people, actually 19%, were actually using seatbelts as of 1981. So we passed that law just because sometimes you have to get people to do the right thing.
Thank you, Dr. Betz. The next question is back to you, Dr. Betz, and it is, why does it seem that a significant number of people inoculated against the flu appear to develop flu-like symptoms?
We get this question a lot because, especially with the injectable influenza vaccine, it'll take 10 to 14 days before that becomes effective in terms of producing protective antibody levels. And so if you've been exposed to the virus during that time, you can come down with influenza even though you've had the vaccine. It's not always 100% effective. That's another reason for why we try to get as many people as we can immunized, because the vaccine doesn't always work in everybody. It's not 100% effective. But the use of the vaccine is we recommend it for that reason, just because it does provide in terms of herd immunity good protection. One other thing about the influenza is that it's not just the influenza virus. There's usually two influenza virus type A's along with a type B every season. This year we're going to have H1N1 along with the two type A's and type B's. And then there's also a whole cadre of other respiratory viral infections that are going around, such as respiratory syncytial virus, adenovirus, and these are causing a lot of influenza-like illness. And so people may think they have flu when it's actually one of these other viral infections. So it is true that people can get the flu vaccine and then come down with something that appears to be flu. But it may not be because the vaccine's not protecting them. It may have some of these other factors going on.
Thank you. Who's going to rebuttal that? Ms. Richardson? No rebuttal? Dr. Tenpenny? All right.
Less than 15% by the CDC's own data, less than 15% of circulating viruses are influenza viruses on over a 10-year average period of time. So people can get the flu shot and can still get influenza-like illnesses called the flu. So one of the reasons that people can still get flu-like symptoms is because they may get something else, not because they may have been exposed to the flu before they got the shot. Also, flu mist is the nasal vaccine that goes up the nose, which is an attenuated virus that says by its own package insert it sheds for up to 21 days. The other thing is, that the flu shot doesn't really work. The Cochrane collaboration data said that in all three populations, children, middle-aged adult, and senior citizens, when they looked per age group, that they said that the flu shot was no more effective than placebo for protecting people from getting the flu.
Thank you. Dr. Tenpenny, the next question comes to you. Are there, and you partially answered this, are there really live viruses in the H1N1 vaccine? And is it possible for mass vaccinations using live viruses to cause a pandemic?
The flu shot, the injectable flu shot, has inactivated viruses in it, so that's not going to be a spreadable type virus. But the live attenuated or weakened viruses that are in the flu mist vaccine, both the seasonal flu vaccine and the H1N1 flu vaccine, do have the potential for shedding up to 21 days. That's in the package inserts. More than flu mist or any of the viruses, I'm more concerned about the fact that mutant viruses are being created by the overuse and massively overprescribed Tamiflu. A 2005 study from Japan documents that 16% of flu viruses develop resistance to the drug each season. That's 1 in 6. And there's a major and ongoing concern that Tamiflu-induced drug resistance can lead to the potential and emergence of mutant viruses, just like the overuse of antibiotics have led to resistant bacteria. Mutations can be antigenically distinct from the original viruses treated with Tamiflu. In other words, the use of Tamiflu can cause an antigenic drift and create a pandemic that officials are so worried about. There were a flurry of articles that came out to suppress and deny the implication of the broad use of Tamiflu, but almost weekly, when you read the World Health Organization data, they say that there are Tamiflu-resistant viruses that are popping up in various portions of the world. So I do believe that scientists are actually concerned about the potential of a mutant virus being out in the environment and then sort of mating up through a process that they call reassortment with another type of virulent mutant virus. And that could be more of a cause and a problem with a developing pandemic than I think from the flu shots.
Thank you. Dr. Betz.
Yeah, actually, it seems like there's kind of two parts to that. There are, in the flu mist, as Dr. Tenpenny pointed out, this is a live attenuated virus. It was actually developed by Dr. Paul Gleason, who's over at Baylor. He's been working with flu since 1966, and I consider him probably the most knowledgeable expert in Texas. We were hoping to get him up here, but he's actually over at WHO in London working on flu right now. But that is a vaccine that even though people have voiced concerns over it, can it spread person to person? It doesn't appear to do that. The issue of Tamiflu, last year's H1N1 seasonal virus, it's not the H1N1 we're dealing with now, all by itself developed resistance to Tamiflu. There wasn't any Tamiflu pressure put on it. It just popped up. It was 100% resistant last year. This H1N1 this year is sensitive to Tamiflu.
Thank you, Dr. Betz. Ms. Richardson, let me ask, should individuals have authority over their own health if it potentially endangers other individuals?
A useful exercise to examine this question would be to consider what the scenario would look like if you actually answered no to this question. You would then be supporting the alternative premise where instead of you having authority of your own health, the government would be in control of your healthcare decisions, even if the government's decisions endangered your health. Does that scenario sound familiar? It should, because that's exactly what vaccine mandates do. They allow for the government to have authority over what vaccines are injected into you, even though their decision could harm you. Let's test out this logic with a completely different but similar line of thinking. On the U.S. government website, said organdonor.gov, it states that from January 2009 to July of 2009, there have been a little over 16,000 organ transplants in the United States. And yet, as of November of this year, there are well over 100,000 people still on the waiting list. Clearly, there's more of a need than a supply. Well, if you look at most of us in the audience here, most of us have 2 eyes, 2 lungs, 2 kidneys. What would you think if you were required by law to give up one of your spare organs for the benefit of someone you don't know on that wait list? My guess is most people would not want to be forced by law to risk surgery and complications to give up an organ for someone they don't even know. These decisions are and should be made on a voluntary basis where the person facing the procedure understands the risks involved and makes the decisions for themselves. When a healthy person is vaccinated, they face a real risk of a vaccine reaction. When a healthy person refuses a vaccine, the risk of infection becomes theoretical and dependent on a sequence of unpredictable events. Nobody can know for certain if you are not vaccinated that 1, you will be exposed to a vaccine-preventable illness, and 2, if you will contract the illness, and 3, you will expose someone else and they will contract it, and 4, they will have a bad outcome. On the other hand, vaccine risks are so real that for every vaccine purchased in the United States, a 75-cent tax is collected to go into a national fund to pay the medical expenses for those injured by vaccines. The United States Health and Human Services National Vaccine Injury Compensation Program has already paid out close to $2 billion in damage claims for vaccine injuries caused by vaccines that have been fully tested and deemed safe for routine childhood vaccinations. This program was set up by Congress in 1986 to shield vaccine manufacturers from being sued for the harm caused by vaccine reactions. There is no other product on the face of this earth that you are forced to use by law that has a tax in it built in to compensate for your medical bills and your hurt. You need to be making these decisions for yourself, not the health department employees who don't even know you or your family health history. It is morally unacceptable to knowingly sacrifice individual healthy people for the theoretical benefit of vaccines.
Thank you, Ms. Richardson. Dr. Betz. Dr. Betz, would you like the rebuttal?
Well, actually, any of you that are smokers pay a considerable amount of cigarette tax for the public health consequences of smoking. If those of you are interested, the New England Journal of Medicine has a lot of good articles that are usually, if they have public health or public relevance, are freely available as downloads on their website. This last week they had a mandatory vaccination of healthcare workers that looked at the New York position, but there are various constitutional amendments that are relevant to this. The 4th and 14th Amendments are the ones that are used by those people who say that vaccination mandates shouldn't be used, but on many occasions, dating from 1905 with Jacobson versus the Commonwealth of Massachusetts, the Supreme Court and other judiciary bodies have ruled that the 10th Amendment, saying that the public good outweighs the rights of the individuals where there's clear benefit, takes precedence.
Thank you, Dr. Betz. Okay. Dr. Betz, the next question is for you. How does an individual who refuses to be vaccinated pose a threat to those who have been vaccinated?
I probably won't need all 3 minutes for that. As we pointed out, vaccines aren't 100% effective. And so the way we get around this is by basically vaccinating everybody to the point where the risk is greatly reduced in that cohort or group of people. And so the idea about trying to get everybody vaccinated is that those few people who do not respond effectively to the vaccine will have less risk of being exposed by somebody who's introducing that into their community or situation.
Who chooses to rebuttal that? Ms. Richardson?
If you decide to put your faith in the protection of a vaccine and it doesn't work for you, it's not your neighbor's responsibility to take responsibility for a drug company that doesn't produce a product that works for everyone that it's intended to work for. You should not be putting yourself at risk for somebody else who can't take a vaccine. Every single person, if we all do what's best in our best interest for our own health, we'll all be healthier and we'll achieve better public health.
Thank you. Dr. Tenpenny, are there any medical alternatives to vaccines in combating the flu?
I think there's dozens.
You want to share them with us?
Sure. I think that the most important thing that I have done in the last couple of weeks, actually, is done an awful lot of research on looking at the benefit of vitamin D. And that I found that there's more than 5,000 articles about the mechanism of action of vitamin D, and that low vitamin D has been associated with an increased risk of recurrent respiratory infections, increased incidence of colds and flu during winter season in children, increased risk of asthma exacerbations or more exacerbations in steroid-dependent asthmatics, and these are all referenced from the conventional medical literature. Increased risk of preterm labor, increased risk in pregnant women for contracting infections when they have low vitamin D levels. In fact, I sort of walked away from all of that research saying, if we looked across everyone and made sure from the time that children were born that they say that they need an additional 400 units of vitamin D a day, and particularly in areas where they don't have a lot of sunshine, above the 37th parallel in this country, and that if we had everyone's vitamin D level up above 60 nanograms per milliliter or above, more than 200 is considered toxic. So if we had it between 60 and 80, and we didn't vaccinate everyone on all of these diseases, I think that we would have a very healthy society with very low infections and very low other types of health problems in the course of about 4 to 5 years, and very inexpensively. I think that I want to make one comment about Jacobson versus Massachusetts in terms of vaccination, is that when that law was passed in 1902, they had one vaccine that they had to deal with in terms of what was to the benefit of the risk of the individual to the benefit of the society. Now we're talking about 19 different vaccines. We're talking about a variety of different doses of vaccines, 113 vaccine antigens by the time that children go into kindergarten. I think that that's a very different scenario than a one-time risk, than one vaccine in terms of the public health related to the individual. One other thing, I got another minute, I think a little bit more time.
Yes, you do.
Other types of things that are really very important for public health and keeping you healthy. Vitamin A is very important. Vitamin A in the wintertime. Even in third world countries, we give children vitamin A before we dose them with measles. We don't do that in this country. We just make the assumption that their vitamin A levels are high. There's a large number of herbal products. There's other types of things. There's basic health things that the CDC talks about. Things like washing your hands not obsessively, drinking fresh water, getting to bed on time, sneezing and coughing appropriately. All these different things. There are lots of things that you can do. And I think it's really important that we don't just keep vaccinating everybody. I mean, how many microbes are on your seat where you're sitting right now? In this room, in your house, on your pets. The only bugs we make a really big deal about are for ones for which we have vaccines. And if we were all these really frail little humans that suddenly were going to fall over dead at any minute, then I think that we should be really much more concerned about vaccination.
Thank you. Dr. Betz.
Well, first of all, I would agree that nutrition plays an important role in not only combating an infection, but also one of our main problems in our society right now is just the lack of exercise, obesity, overweightness in our population, and a lot of that has to do with just behavioral and eating styles that are not healthy. And I would certainly advocate or support your concern about vitamin D deficiencies among people. On the other hand, I think we have mentioned Tamiflu. There are occasions where this is an effective antiviral drug against influenza A, and I see Priscilla kind of nodding her head because she and Rebecca were at a outbreak in a camp in the Wimberley area where it was just getting completely out of control, and within 2 days the use of Tamiflu shut it down. So there are indications for some of these antivirals. They do work, but there are clear indications when they should be used and when they shouldn't be.
Thank you, Dr. Betz. I will add one thing to Dr. Tenpenny, and whether you choose to have additional vitamin A, vitamin D, you do have to remember that she gave a measured amount. Vitamins A, D, E, and K are fat-stored vitamins, and you can actually get too much. So, you need to consult with someone. Be sure you read the literature as to how much, if you so desire, to pop some vitamin D, vitamin A. All right, next question. Ms. Richardson. Does the need to protect societal health supersede individual rights constitutionally guaranteed under the Fourth Amendment?
Just a few weeks ago, constitutional attorney Jonathan E. Mort published an article entitled "Mandatory Vaccination is an Assault on Individual Liberty." He writes that vaccine mandates offend the core definition of liberty that underlies our Constitution for a person against his or her will to be forcibly injected with a foreign substance. He astutely states that vaccination is one of the most extreme examples of prior restraint in the law. Vaccination is not limited to the ill. It aims to stop disease by compelling the vast majority of healthy people to undergo inoculation. It attacks the innocent and makes them bear the burden for those who become ill, compelling them to tolerate the risk of foreign agents injected into them as a way of reducing overall risk of disease. I'd write down his name and go read some of his stuff on the internet. Jonathan E. Mort, he's a constitutional attorney, he's great. The Fourth Amendment to the United States Constitution is part of the Bill of Rights, which guards us against unreasonable searches and seizures by the government. This resonates with the citizens of Texas in a huge way. Do y'all remember just last week when we all passed that constitutional amendment putting limits on eminent domain so people can be safe in their homes and businesses? Well, that passed overwhelmingly. The issue of mandated vaccines is like eminent domain for your body. The government is taking our bodies and mandating their use in vaccines for the benefit of society. This is wrong. In the past decade, congressional hearings have raised eye-opening questions about inadequate vaccine licensing and safety standards, conflicts of interest involving drug companies and vaccine policymakers, and huge gaps in scientific knowledge about how vaccines actually affect the body. I believe as a society we can do better. There are many ways to protect society health without superseding the rights of an individual to refuse a vaccine. Our government has waged a war on infectious disease by forcibly invading your body with vaccine mandates. Strict quarantine laws requiring sick people to stay home with proper enforcement mechanisms is a much more realistic and humane way to go. Other tools like face masks and emphasis on simple hygiene can go a long way, including everything that Dr. Tenpenny said. Most vaccines wear out, and some people, they're called non-responders, they don't even produce a vaccine response in spite of repeated injections. So what that really means is even if you're vaccinated, you're not guaranteed anyway. Accepting the casualties of a mass vaccination system as necessary collateral for protecting society is just plain wrong. Opt-in informed consent is the best system for everybody.
Thank you. Dr. Betz?
Yeah, the constitutional amendments that seem to come into play consistently on this are the 4th, as you were talking about, the 14th, and then also the 10th. And the 10th is basically, gives states, I guess, police power, if you will. I would just quote from this article we were referring to, yet on the basis of principles outlined in Jacobson, the judiciary has consistently affirmed that an individual's right to refuse immunization is outweighed by the community-wide protection confirmed by the immunization. It's kind of like Spock, the needs of the many outweigh the needs of the few.
Okay, thank you, Dr. Betz. Now, questions that they've not had privy to. Dr. Betz, may I ask you, is there any evidence that individuals who receive vaccines actually develop more health problems than those who do not receive health vaccines?
The data in terms of the incidence of things like autism, ADHD, and that, we're in a society right now where at the school age level, except for those that you pointed out that have a waiver, most of our children are vaccinated. In looking at the temporal relationship, and I think one of you brought this out, there really isn't the 2, 4, and 6 months relationship. And speaking epidemiologically, if you look at when these events happen in children, they are not temporally related to vaccine administration. Now, there are some vaccine issues. When the rotavirus vaccine came out, there was a problem with intussusception, and that vaccine was pulled off the market and subsequently changed and remarketed to an effective and safer vaccine. Likewise, through history, we've changed the pertussis vaccine from a whole cell product to an acellular vaccine that's proved to be much safer. Back in the oral polio vaccine was highly effective, but it was so successful we had hardly any polio cases going on, and the polio cases that were popping up were actually related to the oral polio vaccine virus. And so now we've had a new modified Salk type inactivated polio vaccine that we use in this country just to keep paralytic polio related to the vaccine virus from occurring. I think this requires people to look at what's going on, examine the data. We do try to keep track of any adverse effects and follow these along. And I think we've had a pretty good track record in doing this, and we actually have identified problems with some vaccine and pulled them off the market.
Thank you, Dr. Betz. Dr. Tenpenny, I believe you're going to rebuttal this question.
This is the area where I spend an awful lot of time researching. And I know that I've pulled more than 350 articles personally looking at the side effects and complications that vaccines have caused. A lot of it is things like the gelatin that is in the flu shot and in the chickenpox vaccine, which has been documented to prove out to cause allergies and elevate IgE levels, which can cause asthma and allergies. But the pertussis antigen, which has been shown to elevate IgE, which can cause asthma and allergies. Polysorbate 80, which has been shown on multiple types of exposures, which is in the DPT and the HPV vaccine, which can cause anaphylaxis on re-exposure. Squalene, which is not currently in the vaccines here in this country, but it is in the anthrax vaccine for our military and is being introduced into vaccines, particularly flu vaccines in Europe, has been shown in experimental mice and rats to cause debilitating arthritis and Guillain-Barré type syndromes in almost 100% of the experimental animals. The hepatitis B causes an enormous amount of injuries, including a long list of neurological types of complications and rheumatoid arthritis. So there is very much a lot of scientific research that shows that vaccines do cause a lot of debilitating diseases.
Thank you. Dr. Tenpenny, let me ask you this question. Is there any way that vaccine mandates by state or federal government sets a dangerous precedent?
Well, I think that Dawn has pretty much addressed that already.
She has. Do you have anything to add to that, or?
I just think that that public health really needs to broaden its perspective beyond the role of high vaccination rates and low infection rates, which is what we seem to hear repeatedly seems to be the only concern. And if we can vaccinate for every type of bug and do away from every type of infectious disease, then we will somehow magically have public health. And I think that that's a false premise. And I think that mandates will not contribute to that. In fact, if anything, the more vaccines we do and the more that we demand that vaccines are turned into mandates, I think the more health problems we'll have. And I think that the more that the general citizenry is going to just revolt against vaccines altogether and just say that the more that that gets forced on them and they no longer have choices, the more that they're going to refuse everything about vaccines.
Dr. Betz, do you have a rebuttal for that?
Well, first of all, I think those of us in public health are involved in a lot more than just vaccine preventable disease activities, although because of the worldwide pandemic with this H1N1 novel virus, that certainly has been taking a great deal of our focus. But the realities are that we are public citizens. You don't elect us, but you are the people we serve. And we really are focused on a whole variety of public health issues, including vaccine-preventable diseases. But this includes smoking, cessation, nutrition, injuries, all the things that are out there, and as well as the socioeconomic, cultural, and behavioral types of events that are impacting our lives. I would point out that each year in this country, there are 5,000 new chemicals that are introduced without very much study to them. And to suggest that the vaccine is the culprit in all of these problems, I think really ignores the tremendous impact that technology has on introducing these new chemical compounds, often without any type of testing into our population. Yeah, just let me add one other thing. I mean, there are people who have been worried about the mercury content in some of the flu vaccines. I would point out, and you can go to the National Research Defense Council to check their website. They're certainly not a government entity. But you're going to get twice as much mercury out of a can of tuna fish than you will from any of these vaccines. So I think we have to be aware that there's a lot of chemicals in our midst because of technology.
Thank you, Dr. Betz. The next question is for you, Ms. Richardson. Are vaccine mandates, and you've really touched on this, but there's so much concern about, does the government have the right to mandate vaccines, medications, and our health? Your question, are vaccine mandates legal, and does the government have the authority to impose these mandates?
Well, yes, right now they do, because that is what the law of Texas and the law of all 50 states say. Different states have different exemption policies. Some have religious exemptions, some have medical, some have philosophical exemptions. But across the United States, starting around the beginning of the 1970s, right around that time period, state by state, through this program called Every Child by Two, which had Betty Carter and Betty Bumpers and Rosalind Carter went around, and they were advocating. They came up with this idea, no shots, no school. And vaccine mandates really are mainly a recent phenomenon. But I find that when I go down and talk to state legislators and explain to them what the parents who contact me through the internet, and it's bizarre that they have to contact me, why aren't they contacting the health department? You know what? Because there's no division of the health department in Texas to call them and help parents with vaccine reactions. So they have to call a mom who volunteers her time. But anyway, when I talk to these legislators and have them meet these parents and what they're going through, they realize that parents do need to be in charge of these decisions, and they respect that. Some of them don't, but most of them do, and that's why the law was changed. As a matter of fact, in 2007, our governor, Rick Perry, went ahead and issued an executive order to compel the health commissioner to require HPV vaccine for all 6th grade girls. Well, I had an 11-year-old daughter was about to turn 11, and I was not happy with that one bit. So we went down to the legislature, and when we had hundreds of parents, thousands of people calling, and the legislature in the final vote in the House of Representatives, it was 130-something to 2 to override Rick Perry's mandate. I think that these good people out there that are put there by your votes need to hear from you. Yes, vaccine mandates are illegal, but they don't have to be. We are a government of the people, by the people, for the people. People, get moving and talk to your legislators.
Okay. Dr. Betz.
Well, I think without supporting or criticizing the governor, I think that the right thing was done for the wrong reason, and I guess to have your son involved in some of the fiscal things related to Gardasil is problematic. The reality is this is a very good vaccine for an important problem, and cervical cancer is pretty much a preventable disease caused by the HPV virus, which is what the Gardasil vaccine does. Excuse me?
He's working. He can answer the question. Yes. Okay, let's continue, and let's continue, Dr. Betz.
So anyway, I think sometimes the right thing is done for the wrong reasons. I think the governor was called on this, and things were changed, but I think the vaccine got caught up in this thing, and it's actually probably a worthwhile endeavor because cervical cancer is a big killer.
Thank you. Now it's time, thank you all, thank you panelists. Now it's time for us to open up the forum for questions from the audience. During this time, you've got 1 minute to ask your question. We would like you to, those of you who have a question, to line up in the aisle, and we will take we've got 2 aisles. I'm going to give you a minute. If some of you need to step out, then we'll start again in about 1 minute. 1 mic? Okay. All right. Thank you. So if anybody who has a question will line up at the mic, we've got 1 mic over here, line up in the hall, in this aisle, and we'll get to your question. You can address it to whichever panelist you would like. They will have 3 minutes to answer your question, and another panelist will be able to give a rebuttal to the answer that the panelist gave. I would remind you that this is your opportunity to ask a question, not your opportunity to comment in general. Let's take advantage of the panelists that we have and ask the question that you really would like to see answered. Keep your questions brief and to the point of the debate. Okay, we've got first person. Let's go ahead and start. What's your name?
My name is Janet Jones. And my question, I guess, is for Dr. Betz. Probably be really well informed on this one, particularly about the H1N1 vaccine. And a lot of the package inserts that you see in all vaccines, it has a list of ingredients, and there are, you can actually go through those and know what is in that vaccine. And for the H1N1 vaccine, there is no list of ingredients, and it has not been exposed to the people exactly what is in that vaccine. How are we to make an informed decision for ourselves on whether or not we should take that vaccine, and particularly if that vaccine is required? How are we supposed to know and be informed in that decision?
Thank you. Dr. Betz.
If you go to the CDC website, and that's www.cdc.gov, they have a weekly publication. It's called Morbidity Mortality Weekly Report, and that's too big a mouthful, so everybody just calls it MMWR. If you go to the October 8th edition of this year, page 1100 and 1101, because there's a very nice table of the 4 vaccine manufacturers, exactly what the age group is, what the vaccines have in them in terms of mercury content, if they have them at all, because several of these vaccines don't have any mercury content. And I think it has, I'll answer a lot of the questions you have. It's basically the kind of product information. Yeah, you can probably just Google it. Google or Bing it to CDC, but it's www.cdc.gov.
Okay. Does either of you have a rebuttal to the question? information question.
Well, for lots of information that we have, there's a website that we've put together that gives people tools and toolboxes, tools in a toolbox on a website called pandemicfluonline.com. That you have flyers and information that is the other side of the story. So if you're looking at the CDC's website, you may want to look at another website that has put together scientific information that you can use for your own community, for handouts and flyers and PowerPoint presentations that are free, and it's pandemicfluonline.com.
All right, thank you. Next question. What's your name?
My name is Dr. Matthew Buckley. I'm a doctor of chiropractic.
Okay.
And I've got a legal question.
And who is this? Which panelist would you like to address this?
Dr. Betz.
Dr. Betz.
So I don't know if you're aware, but the Obama administration has moved to provide all vaccine manufacturers legal immunity to any harmful effects to the vaccines. And so if the vaccine manufacturers are circumventing the legal obligation of providing a safe product by being granted legal immunity for damages from vaccine injury, would you support having all doctors who administer the vaccine sign a legal document binding them to cover damages that may result from the administration of the vaccine? If not, why not? And who should be responsible for the damages that these vaccines do indeed cause neurological harm, like the 1976 swine flu vaccine program did?
Dr. Betz.
I would have to, I guess, look at the actual wording on that. And in fact, the physicians who are administering this vaccine are also given being held harmless. Now, back in 1976, there were about 40,000 cases, reactions, usually the Guillain-Barré syndrome, as you pointed out, to the 1976 flu vaccine. And these cases were settled and payment was made. I would, I guess, have to look at the specific, legal wording on this. But one of the ways for getting this vaccine out was to have the CDC basically oversee and the government underwrite all of these 4 vaccine manufacturers that came out with the novel H1N1 product. And I don't think this holds any, if there is a significant adverse effect that's proved to be related to the vaccine, I think that would be, I don't think that's going to, preclude people from getting reimbursed for damages.
So you're saying that the government would actually cover the damages?
The government's covering this entire program.
So we would pay for it indirectly through our taxpayer dollars to fund this? Okay, thank you.
That would be right.
Do either of you have a rebuttal to that?
I do. Actually, that would be wrong. This vaccine is being treated differently than other vaccines. The National Vaccine Injury Compensation Program is set up to include vaccines that are put on that childhood schedule. Remember at the beginning of this, I told you how vaccine mandates come about, and it starts off, the CDC, when they publish it in the MMWR, and then it becomes recommended for general use. That automatically puts that vaccine under the Vaccine Injury Compensation Program. Right now, Sibelius had written something up, I can't remember how to call it, but if anybody want it, go to my website and contact me. I'll tell you what it was. But there was an order issued. There is no compensation for this vaccine. So guess who pays for it? Either your health insurance or you, and you're still going to pay for it for everybody else's health insurance because your rates will go up. So no, the government is not covering this vaccine right now. People need to know that clearly. When smallpox vaccine was being pushed for first responders, the state legislature had to initiate specific legislation to allow for damages for emergency responders to cover it. We don't have that for this vaccine right now.
Thank you. Next question. What's your name, sir?
My name is Sean McAnally, and my question is, I've heard the whole more mercury in a can of tuna
and
in the shot.
Is this question directed to?
Actually, Mr. Betz.
Dr. Betz, okay.
Dr. Betz, I've heard the whole there's more mercury in a can of tuna before. But wouldn't there be a difference between eating mercury and injecting mercury into your veins?
Well, the vaccine doesn't get injected into your veins, hopefully.
Into your body.
I mean, the point is that, methylmercury in fish is rapidly absorbed. If you like to go to El Arroyo and you get their little tuna steak there, that's even got more mercury in it. The point is that there are a lot of chemicals in our environment, and some of these are equal or greater than some of the concerns in the vaccine products. And again, as I mentioned, several of the vaccines, like the flu mist and some of the it's the multi-dose vials that have the thimerosal in it as a prevention product for bacterial and other contaminations. All the pre-filled syringes and the flu mist vaccine, which are basically single-dose products, don't have any preservative in them.
So you're saying there is no difference from eating mercury as opposed to injecting it into your body?
The methylmercury in fish is going to get absorbed pretty completely, yes.
Any rebuttal? Or next question.
I think that we could have an entire 2-hour debate on the mercury issue. But I would agree with you, and because I think that there's more than 10,000 articles that are published in the toxicology literature through the EPA and all these other places that show the toxic effects of mercury when it is injected into your body, and that it is different than ingestion, and there's nothing to show that ingestion is totally absorbed. It's mostly bound up in the stool, and it goes out in the stool. Or it can, if it is absorbed, it goes out into the urine. And the tests that have been done recently to look for mercury in the bloodstream, it doesn't live in the bloodstream. As soon as it goes into your system, if it's injected or ingested into your system, it goes into tissues. It can cross the blood-brain barrier, and it can cause problems in the brain. So I think that maybe Dr. Betz would be so kind at some time we'll come back and do a mercury evening, and we'll talk about all the different additives. But I personally think there's a big difference, and I think the science on this is not finished. And when the CDC wants to say we've concluded, there's no connection, there's no problem, the science is done, when is the science ever done? It's not. The story is not closed on this one yet.
Thank you.
Thank you.
Next question. What's your name, sir?
My name is Larry Falzetto, and I hear a lot about vaccinations. And I was wondering if Dr. Betz knows that this is the only country in the world that's treating people with cancer instead of curing them. I mean, over in Europe, they're actually curing people of cancer. You know how they're doing it, Dr. Betz? They're doing it with something called ozone therapy. That's where they take a part of your blood out.
Let me double check your question. Your question regarding vaccines.
My question is, why aren't we curing people? Why are we using vaccinations instead of ozone therapy to cure disease?
I'm not sure that that's quite to the point, but I'll ask Dr. Betz if he's got a response for that.
Has he even heard of ozone therapy?
Yes, I've heard of it, and it's interesting you should ask because unless my son happens to be an oncologist, radiotherapist, physician over in Switzerland, and he certainly sees a lot of people that are dying of cancer over there. So if you're talking about the rest of Europe, then I can't address that, but I can assure you that people are dying of cancer in Switzerland with or without ozone.
Well, it's amazing that cancer is anaerobic, Dr. Betz. It's not aerobic.
Okay. Thank you for your question, sir. Next question.
Hello.
Hello. What's your name?
Christine Bennett.
Miss Bennett. Thank you. Who do you want to address your question?
I would like Dr. Betz to answer this question. I actually have two questions. Is that all right?
All right. Yes.
My first question is, I don't remember the exact date, but in the 1980s, Merck Sharp and Dohme developed the hepatitis B vaccine for drug addicts and prostitutes. So why is it given to newborn infants before they leave the hospital?
That's just one question, right?
That's correct.
Okay. The hepatitis B vaccine initially it started out as a plasma-derived product and purified, but because of the concerns that this was possibly associated with transmission of HIV, they rapidly turned over to a recombinant form, which is just basically a 28 peptide ring that's now been given. The problem was we weren't getting a handle on hepatitis B transmission in this country. We weren't able to capture the populations at risk. These were usually sexually active or needle sharing or people involved in risky sexual activity, and they were not the ones showing up in clinics to get vaccinated. And so the decision was made that to create just a protective cohort that, as they develop and grew through the years, would be protected. And so that was the reason for the vaccine requirements of children.
Let me allow, if you want to go ahead and have a rebuttal.
You had a second question?
I'll have her, I'm going to have just a rebuttal to that. It will.
The 1991 position paper on the hepatitis B vaccine was the reason that hepatitis B started to be given at birth in this country. And that paper basically said it was because the hepatitis B was endemic in third world countries and prostitutes that it should be okay to start giving it to newborns in our hospital. And that was it. That was the science. And the CDC's own information says in unpublished data that by the time children are 12 years of age, more than 60% have already lost any hepatitis B antibodies that have been developed. So, by the time your kids are old enough to be IV-using, drug-abusing prostitutes, the hepatitis B is no longer there at all.
Okay. Your second question?
Yes, ma'am. Thank you. And this again goes to Dr. Betz, but I want to reference something that you said, Dr. Campbell, and you said that you mentioned that vitamins A, D, and K have upper dose limits. And Dr. Betz, as a physician, it's my understanding that the oath of being a physician is to first do no harm. What upper dose limits have been studied in vaccines?
In general, the studies, the vaccine dosage is dependent on how much antigen do you need to administer to get the protective immunologic effect. So there really isn't like an upper dose. I'm sure in animal studies and that they probably have got upper doses, but the studies that are done on humans are for antigenic or immunologic response to the antigen present.
Okay. Do you, Ms. Richardson or Dr. Tenpenny, have a rebuttal to that?
The three doses of vaccines that we give are based on the theory of immunology. That the first one you need to be exposed, the second one is a boost, and the third one is to cover all those people that didn't get boosted the second time. And when you read the studies that are done on the vaccines, and a lot of them used to be published in the package inserts, but the package inserts are shorter now, so you have to go finding the journal articles to read them yourself. That many of the kids had high enough antibody doses after the first and second dosages, and we don't do titers to know how high that those can be. And that those titers, by the time you give the second and the third dose, and for hepatitis B people, adults that are non-converters, and we give another and another and another dose, we don't know how high those dosages actually go. And sometimes they're in the tens of thousands in the research papers that are done. We don't know what the long-term consequences of that is. We don't know about molecular mimicry that might start with those antibodies. We don't know about autoimmune reactions. We don't know what the attrition rate is in any individual person, only in a pooled study. So, and we also assume that if a person has an illness, like a cough, and they've been vaccinated, couldn't possibly be pertussis just because they were vaccinated. And that's a really false premise on antibodies, too.
Thank you. Next question. Just pull the mic down. Yes, what's your name?
Tammy McKeska.
Thank you. Go ahead and ask your question. Who's it directed to?
To Dr. Betz.
Dr. Betz. Okay.
If the state or federal government is given the legal authority to force a vaccination on the population, what would legally prevent the government from declaring that we have a depression epidemic that requires SSRIs such as Prozac to be taken mandatorily?
Oh, that sounds like a hypothetical. If you go ahead, Dr. Betz.
Well, I think the issues regarding public health and the government's mandating immunizations are to protect the population in general, and usually this is referable to a communicable disease condition. So I don't. I think you can carry
this to some type of conclusion. I don't really think it's a realistic type of thing. I do not think the government's going to be, forcing us to take, antidepressants. But the vaccine requirements are to protect the community at large.
Okay. Ms. Richardson, do you have a rebuttal?
Yes, I do. When my first daughter was born 13 and a half years ago, all the literature that I read said that vaccines were there to protect your child. Then as more parents and more consumers realized that vaccines were causing reactions, the message shifted. Now it's your responsibility to be vaccinated to protect the community. It's interesting how that's changed. When you look at all the functional creep of government taking more and more control of your life, it is not an unreasonable concern to have that if the government can impose the injection of something into your body, they can also impose a drug. As a matter of fact, in the Health and Safety Code right now in the emergency power language, the Health Department, the Commissioner has the right to order control measures, including chemoprophylaxis, which is drugs to arrest the spread of disease. So they already have that authority in law to mandate some drugs to take in your body. And it's a misdemeanor that is, for failure of following, a jail time and a fine. So, yes, it is a concern, and we all have to be vigilant with our state laws to prevent that from happening.
Thank you. Next question. Let's go ahead and have, we've got a long line. Let's go ahead and let somebody else ask a question.
Hi, guys. My name's John, and I really appreciate you. I just wanted to say I appreciate all you guys being here. This is a very useful seminar, and I really have benefited significantly. I wanted to briefly touch, I have a 13-year-old son as well, and he had a dramatic reaction to his series of vaccines, and we didn't know any better either, but he changed dramatically, presenting autism symptoms and so forth. It's been very difficult. It was right after he received 4 consecutive vaccines, just a little tiny kid, and I will continually feel guilty for allowing that to happen. Nevertheless, I have another child who's now 7, and we have thankfully you guys have changed the law, so we were able to opt out of some of her vaccines, although we always stand in fear that somebody's going to knock on the door and say, oh, the CDC's here and come after them. We're afraid that they're going to do that at the school. So we constantly caution her to be very careful about the school situation. If she sees other kids coughing in her room, to call us, and we'll come pick her up and try to keep her safe. Well, regardless, she contracted swine flu, as did all the other kids in the school, and they've all now had swine flu. And I guess that's good because she got through it pretty fast with natural treatment, basically bed rest and so forth.
So your question actually is...
My question is, why does the CDC now say that they still need to take the swine flu vaccine when they've already had the swine flu? Wouldn't that be enough? Wouldn't that certainly be enough protection, or better than the 2 additional vaccines?
Is this directed to whom?
Well, I'd like anyone who could answer. Maybe Dr. Betz. Probably that would be most appropriate since you are with the CDC.
Dr. Betz, Don will have you.
We've had several discussions on this. We have sometimes daily, always weekly calls with the CDC, state officials, and the public health community on this issue. From a scientific perspective, probably if somebody has been confirmed either through culture or through the PCR testing, not the rabbit flu test, to have H1N1, I would think that the case could be made that they probably are not going to get much benefit out of the vaccine. However, the state and CDC recommendations are that since most people are not going to get specifically tested, and since other things can cause the influenza-like illness, that we don't assume that somebody had H1N1, and the recommendations are to get the vaccine. I myself had H1N1 about a month ago, and I got the vaccine a couple weeks ago just because that's what we've instructed people to do.
Don?
The CDC stopped hyping for swine flu.
I did not have a confirmed case. That was a problem.
Oh, okay.
Her doctor did confirm it, but is that going to be adequate? Can we take that and say we've had the flu, don't give us a shot, or are they still going to say too bad? I'm looking for a way
Can I answer that?
Okay,
Go
well,
ahead,
let's...
I'm sorry.
Well, the H1 vaccine is not mandatory, so you have every right to deny it.
Well, it's not yet. We don't know what's going on.
I do not envision that the state of Texas is going to make this a mandatory requirement, and certainly Commissioner Lakey and Dr. Valadez and the people who are making those decisions have not indicated that there's any attempt on the part of the state to make H1N1 vaccine mandatory. We would hope people would do it on a voluntary basis, though.
Well, that's good.
Ms. Richardson, you want to rebut?
Yes. From my understanding, looking at information out there, the CDC stopped typing for the swine flu back in August. They're not counting those anymore. When kids go into a doctor's office now, all the parents that I've talked to that have had kids most likely contract it, they're typing for type A influenza, and they're not sending the samples to the CDC to actually know. So it's all being clinical diagnoses. But a very important note to make, if your daughter actually had swine flu, the vaccine provides no benefit and only risk, because when you have a viral illness, you do have protection after that point. The National Vaccine Information Center, an organization that I do some work for, has wonderful information on the website talking about really how low the confirmed number of cases of H1N1 that there are. And Dr. Tenpenny has similar information on her pandemic flu online site, and NVIC is nvic.org. Thank you.
Okay. Next.
Could I just add something, because I think this is an important point. Okay. Initially, the CDC had the only PCR primers for this novel H1N1 vaccine. Those primers are now available commercially. The state of Texas laboratory has these primers. Scott and White has them. I think CPL and some of the other labs have them. And these are these specific primers for identifying not only this type A, but it's the novel H1N1 versus last year's seasonal H1N1, or what we expect will be a seasonal H1N1 this year. So there are labs capable of doing the specific testing now.
Well, again, thank you guys for attending. I really
thank you. Okay, next question.
Yes, I'm Dr. Alan Johnson,
yes,
scientist and engineer. I had an opportunity to spend some time at Texas A&M doing research on being able to contain viruses, the spread of them, and we did simulations on those. And no matter what we did, we could not contain. This is for cattle, so we're talking about hoof and mouth disease, which is quite simple. So for that, with restricted animals being restricted on their movement, we could not contain the virus in the simulation. Also, being an expert in testing, I know that those tests that are performed are not enough to determine whether it is good or bad for the public. So my question to you, Dr. Betz, if you're making a decision about something being good for the public good, and you really don't have enough data to make that decision, is it really ethical for you to make that decision?
Thank you. Dr. Betz?
Well, I think I cannot, comment on the foot and mouth disease in animals, but I think the evidence is clear that for things like smallpox, measles, polio, Haemophilus influenza B, that we've done a remarkable job of containing these within the United States and Western Hemisphere population. So, in fact, smallpox, except for its presence in a few labs around the world, is no longer a human-to-human transmissible disease.
Thank you.
Can I comment on that?
1 minute, sir. Is there a rebuttal to this, or?
I'll let him go ahead and.
Okay, go ahead, sir.
I'll use my time as a rebuttal.
Is this
for
a
him.
follow-up question, or?
Well, it's a follow-up for
Dr. Betz.
Dr. Betz.
Okay, go ahead.
On the polio, the recent data I've seen is that polio, and I think Dr. Tenpenny mentioned it, polio was already on its way out when the vaccine was introduced. So the vaccine did not have an impact on eradicating polio.
Okay. Is there any other comment, Dr. Betz, that you have on that?
Let me get the figures.
Or even just in general, unless you found it? Okay.
Actually, polio wasn't on the way out. The paralytic cases reached a peak in the United States in 1952 with 21,000 paralytic cases. The vaccine was introduced in 1955. In 1960, there was a total of about 10% of that, 2,525 paralytic cases. As we pointed out, there then became the oral polio vaccine from Albert Sabin, and that was introduced in 1961. In 1965, there were 61 paralytic polio cases were reported. So in that 13-year period, we went from 21,000 paralytic cases to 61.
Okay. Do either of you have a rebuttal for that?
The number of deaths from polio in the United States before the vaccine was introduced was around 1,000. Yet, there is a research study that's been published by Dr. Barbara Stanfield from Johns Hopkins that said that the number of deaths per year caused by iatrogenic causes, meaning a doctor was involved, are 225,000. If you take all of the vaccine-preventable diseases put together and add up how many deaths they've caused. He's talking about cases. I'm talking about deaths. He also talked about bad outcomes, but I'm talking about deaths. If you add up all the vaccine-preventable diseases together, the number of deaths before the vaccine, it's 1/6 of the numbers of things caused by hospital-acquired infections, 166,000 for non-errors but drug reactions prescribed by a doctor, 12,000 for unnecessary surgeries, up to 225,000.
Now, Dawn, Ms. Richardson, specifically we're referring just to polio.
Well, and that's why I brought up the polio.
What he was saying.
So,
specifically polio.
Specifically polio. Before the vaccine existed, there were 1,000 deaths. But yet we're inoculating all these kids mandatorily. It should be the parents that decide.
And deaths after the vaccine polio?
They've reduced substantially. Okay. As a matter of fact, the only cases of polio that we've had in the United States recently have been coming from contact with someone who received the live vaccine overseas.
Okay. Well, that's definitely an interesting discussion. Let's go to the next question.
Yes, I'm glad the gentleman before me brought up the idea of diseases just naturally being eliminated. This is for Ms. Tenpenny and Ms. Richardson. So, Ms. Tenpenny, you claim that...
Let me ask you one thing. Tell me again what your name was.
Oh, my name's Ryan.
Ryan, and please specifically ask one panelist.
Yeah, sure. Ms. Tenpenny, this is a two-part question. You claim that that smallpox would have eventually been eliminated and that it was, quote, on its way out the door. I'm curious how much longer it would have taken without a vaccine program to eradicate smallpox and how many more people would have died as a result if there was not a vaccine program.
Okay, stop. Then we'll do your second question.
Sure.
I wasn't the one that said that. That was a quote from Dr. Tom Mack from the CDC, and that there is a graph that shows it was about a 5 to 15 year shorter period of time, because what really eradicated smallpox was quarantine. And when they would go into villages and they would find people that were exposed and that they would quarantine, the CDC said ring vaccination around that, which is what they're claiming is what eradicated smallpox. But when we look back historically over time, what stopped epidemics of plague and other things historically was quarantine. And I think that's one of the reasons why they are talking about things like quarantine, if there is a massive pandemic here, because quarantine works to stop the spread of disease. So that wasn't me saying that. I was quoting someone from the CDC.
Okay, your follow-up.
Could I respond to that?
Let me go ahead and let Dr. Betz follow up with the rebuttal.
The issue of smallpox, it is true that quarantine was one aspect, but it was actually identifying the cases and then vaccinating them and basically vaccinating the contacts of those cases so they would not come down with infection. People like D.A. Henderson, Sensor, Bill Fagey, they were running around Africa. They used to do things like run their Land Rovers and get them stuck in the mud, because then all the villagers would come out to see what was going on. The thing about smallpox, it's a very characteristic infection. You've got these massive, poxes on your face, and so they grab the people and then treat them. And so the last case of smallpox was in Somalia in 1977. Just as a reference, in the United States in 1938, there were 15,000 cases of smallpox. 10 years later, there were only 59 cases reported. And in those states in which compulsory vaccination was in effect, the disease had disappeared by 1942. And the last case of smallpox in the United States occurred in 1949.
Thank you, Dr. Betz. Go ahead for a follow-up, and then we'll try to hold off on follow-up so everybody can get a chance to ask a question.
For sure. The second question is also for Ms. Tenpenny. You claim that there are dozens of alternatives to vaccinations. Specifically, you said vitamin D, vitamin A, herbal supplements, basic health like washing hands or good hygiene. Do you have any scientific or empirical evidence to justify that just taking vitamin D and washing your hands is going to keep you, protected from diseases?
Yeah, I quoted 3 studies in the section that I talked about, and those
or perhaps some methodologies behind the studies.
I will give you the quotes. You can go look at the methodologies yourself. But it was talking about in the research that people that had a vitamin D level below 19 in the studies were at much higher risk of getting infections, and that those that had levels above 37 didn't get the infections. So these were studies. These weren't things I made up. These are things that came out.
I'm not trying to insinuate that. I was just wondering if you had a methodology to back up those empirical claims.
They weren't empirical claims. They were reports from
They are without methodology.
Well, I think that a way to address this...
They were reports from the medical literature that I said I'd be happy. If you want to go to the website, drtenpenny.com, and send me an email, I'll be glad to send you a list of those.
Sure.
Okay.
Thank you.
Thank you both. Next question.
I'm Dr. Steve Clayman.
Yes, sir.
From the Clayman Chiropractic Clinic. It seems a little odd that this is Dr. Tenpenny. It seems a little odd that the autism rate is about 1 in 155 children. When I was born, there was almost no such thing as autism. I find that curious. I also find it a little flabbergasting to think that it's okay to inject a 8-pound child or a 10-pound or a 15-pound child with mercury and say that, well, you're going to get it from the tuna fish anyway. I find that disconcerting, and I wonder if Dr. Betz, you would actually inject your child or your grandchild with those vaccines. Dr. Tenpenny, to you first. On the issue of autism.
I'm not sure what the question is.
Why is there so much autism now as opposed to 40, 50, 60 years ago? Do you find it's related to vaccinations and the mercury in vaccines?
Well, when I evaluate a child or an adult in terms of health practices, or when I do in the clinic, when I see patients, I sort of look at patients and imagine maybe there's a pie diagram sitting on their chest. And that pie diagram has different slices. And each one of those slices can represent things like genetics, the environment, the food you eat, the artificial preservatives, the chemicals in the environment, and vaccines, and several other things. But if you've been vaccinated, that slice of that pie in terms of how it affects your health, in my opinion, is never zero. And I think that we now have so many more vaccines than we've ever had before. I acknowledge what Dr. Betz said about the number of chemicals that are in the environment. The Environmental Working Group did a study that showed that children had something like 256 chemicals in cord blood from the time that they were born. So we've got environmental exposures to chemicals that as soon as those children are born, within 48 hours, we're giving them a hepatitis B vaccine. And then we're piling on vaccines before they even start eating table food. And so I believe that there's a combination of things that have gone on in terms of escalating the autism rate. I think it does have to do with the mercury and other additives and preservatives. I think it's the sheer number and quantity and frequency of vaccines. I think there is definitely an environmental component. And I think that all of that needs to be taken into consideration when we unwind these things with these kids and not just say that it was some coincidence that suddenly they devolved into autism.
Dr. Betz, do you have a rebuttal to Dr. Tenpenny's response?
Well, I think, again, we're in a sea of chemicals, And in reference to your question about, would I inject mercury in the vaccines into my child or grandchild, the answer is yes. Although in the time since my son had the various vaccines with thimerosal in, the manufacturers, especially those that are putting out either the MedImmune FluMist product or the single dose products, they do not require any type of preservative because they're not a multi-dose type of entity. So, as these concerns have arisen, I think, one of the good things about this healthy discussion is if you look at what's happened with the evolution of vaccines since, say, 1980, there's been some considerable progress made in reducing the chemical components in these things to the point where many of them that used to have mercury or other products now are mercury-free. And so the option now for my grandchildren is that they can get vaccines that don't have mercury in them.
Thank you, Dr. Betz. Next question.
Thank you. My name's Peter McCarthy. I'm chair of the Texas Health Freedom Coalition. Our 50,000 members advocate for health freedom of choice at the state legislature. And my question is for, for Ms. Richardson. And I'd like to address an issue that hasn't been addressed so far tonight, and that's the impact of money on the vaccine approval process. You did a great job of summarizing the process for us as to how a vaccine is approved, the need is identified. But I'd like to hear from you some comments about the potential and actual conflicts of interest that occur during the approval process. What do you think the scope of that is, and what needs to change to address that?
Okay, there's a few points here. First of all, on the conflicts of interest, there is a Congressman, Dan Burton from Indiana, who in Congress, he actually did a series of hearings specifically on looking at conflicts of interest. And it permeates from the federal level all the way down to the state level. You can go on our website, vaccineinfo.net. We have the transcripts from those hearings, and found that people in the ACIP committee actually that make these recommendations had ties back to manufacturers. At the state level, when Governor Rick Perry tried to do the executive order for the HPV vaccine, the lobbyist by Merck that was hired by Merck was Perry's ex-chief of staff. Is that a coincidence too? I don't know. But more importantly, what you can look at is if you go to the Texas Ethics Commission website and look up, just go to some page like pharma.org, the pharma organization, look for all the names in this Ethics Commission of all the drug lobbyists that are down at the Capitol. And then you've got parents who don't make any money, who are there trying to advocate for the protection of health for their children, versus lobbyists who are paid a lot of money. I definitely see the money going down through the Capitol and all the way up to the federal level, just pushing the system right along. As a matter of fact, I saw in a recent article that next year we're going to have the vaccine market for children's vaccines is going to top $10 billion. That's a lot of money.
What do you think needs to change?
No mandates. Okay. Dr. Betz, do you have a response?
Well, certainly the pharmaceutical companies, I think, are in business to make money as well as to provide, important medications, including vaccines, for the public. It's the free enterprise system, and actually, if you look at many of them, they really, there are not many of the pharmaceutical manufacturers that are interested in getting into the vaccine business because it's not a lucrative type of endeavor. Certainly, I think it was in Merck's interest to try to recoup their research and development costs, and I don't try to justify people doing that. At one point, the state of Michigan was developing all its own vaccines. It had a vaccine development program within the state health department. I think it was Dr. Wilcox at that point. And so these vaccines were available to the citizens of Michigan without the conundrum of pharmaceutical entities that were trying to make a profit.
Thank you, Dr. Betz. We've had such interest generated, and we appreciate everyone. We've got time for one more question.
Sorry, guys.
Okay. Go ahead.
Hi, my name is Zach Imundi, and I want to thank everybody for coming out. This is obviously a topic that we need to discuss further and educate the rest of the public on, other than this room. My question would be to Ms. I don't know how to say her name. Tenpenny?
Tenpenny, Dr. Tenpenny.
Tenpenny. All right. Tenpenny, that's a dime.
Dr. Tenpenny.
Okay.
I've had my name screwed up before, but never quite. It's Tenpenny, pretty simple.
It's about the vaccination, not about you. No. Okay, my question would be, how do you measure the full safety of a vaccine based on tests done with a time limit before being widely used to vaccinate? Where in the testing process are the long-term problems addressed?
Do you need that question repeated? Would you repeat that question? A little bit slower. I needed it repeated.
Okay. How do you measure the full safety of a vaccine based on tests done that have a time limit before they're going to be spread for vaccination, obviously? And where in that testing process do the long-term effects of the vaccines come into play?
The real studies that it's still a pretty unclear question, but I'll do my best. Okay, I think that the real studies that come from vaccines are after licensing. They're post-licensure. That's the one thing. Because there's small studies that are done. It's small meaning anywhere from a couple hundred to maybe several thousand. But when you finally release that vaccine out into the general community, the same applies for medications that are released. And now millions of people across the country and across the world are now taking the vaccine. That's when you start to really do the testing to see what the side effects are going to be, is post-marketing surveillance. And that's phase 4 clinical trials. The other thing is that I think it's really important to address here before we close is one of the things about safety issues is that we really do need to do the studies of looking at vaccinated versus unvaccinated populations. There are tens of thousands of children that are out there now that have been homeschooled. There's a large practice in Chicago, the populations of kids in the Amish population, chiropractic children. There are tens of thousands of kids out there that are unvaccinated. And so for the CDC to say we can't do that study because it would be unethical to look at that study, the study's already been ready-made. And if we actually look at the fact that unvaccinated kids aren't as healthy than the vaccinated kids, then maybe we need to look at that issue a little differently. But if we do simply a survey study and say, of the unvaccinated kids, how many days of school are missed, how many drugs are they on, what kind of diagnosis do they have, what kinds of grades do they get in school, I'm sure I'm not a study designer, but I think that we could actually seriously look at the unvaccinated population and look at their health versus the health of the vaccinated population, and that's where we're really going to find out where the research lies.
Okay, just a little add-in real quick. I just got one little tidbit. Say that you get a vaccine and a problem occurs 20 years later. What kind of testing do we do now that is going to reveal that problem later?
We can't. There's none.
Okay, so that's not
Dr.
safe at all.
Betz, do you have a follow-up rebuttal to that question?
Yeah, I guess there'd be 2 or 3 points. First of all, I agree that some of these initial vaccination trials are they're small samples relative to the millions of people that may receive the vaccine. And I pointed out the initial rotavirus vaccine that came out turned out to have a problem called intussusception, where the bowel kind of sucks in on itself. And as more people got the rotavirus vaccine, it became, it was obvious that this was a problem. The vaccine was actually pulled from the market. Let's see. The other, I guess, issue I was going to say is that the H1N1 vaccine is being manufactured by the exact same manufacturers that make the seasonal flu H1N1 vaccine, using the same production lines and the same techniques. So I think this is a a fairly effective and safe vaccine. It's actually one antigenic component versus 3 that's in the seasonal flu vaccine. So I think these are, it's proven to be a safe vaccine, and I think it will in the future.
Thank you, Dr. Betz. Now that's the end of questions. Now we will turn to concluding remarks. And in this last phase of the debate, each panelist will have 5 minutes to sum up what they would like to let everyone know. I will have Ms. Richardson go first, followed by Dr. Betz, and then Dr. Tenpenny. Ms. Richardson.
Just like you don't have to be an automobile manufacturer to be an educated consumer when choosing to purchase a family car, you don't have to be a vaccine developer or even a doctor to look at a vaccine and make an educated, informed decision. Whether its safety, efficacy, necessity, or even cost falls within your personal standards. This is the United States of America. You should be free to make that decision without penalty of law. You don't have to be a master's in public health to spot poor scientific methodology when looking at research to support the universal use of a vaccine. Common sense will tell you if the study period was too short of a duration or not enough people were included, if there were inadequate controls, or if safety was even adequately considered. Just like you can research other products or services that you use, you should be able to research vaccines and make your own informed, educated decisions for your own family rather than blindly following requirements set up by people who are from the government and here to help. Do you know that just about every single vaccine has disclaimers on the manufacturer's package insert that read something similar to, "This vaccine has not been tested or evaluated for their carcinogenic potential, mutagenic potential, or for impairment of fertility or reproductive capacity." Seriously, the vaccine manufacturers and government have refused to study and publish answers to the questions of whether vaccines can cause cancer, contaminate your DNA, or prevent your ability to bear children. Why do you think they're avoiding these studies? Why do the tobacco companies deny having studies linking cigarette smoking to the development of cancer? I don't know. What about the swine flu vaccine and everyone in this audience? Can it be legally required right now by law in Texas? There is a mechanism where it could be. So we're trusting Dr. Betz to say, no, they're not planning on doing it right now. But in the Health and Safety Code, there is a provision where the health commissioner could create a unilateral rule, a new rule requiring a vaccine, or some health authority could do the same and order you to be vaccinated. Both of these actions require lawmaking, execution, and judicial interpretation by, again, an unelected, unaccountable bureaucrat. The separation of powers devised by the framers of the Constitution was designed to do one primary thing, to prevent the majority from ruling with an iron fist, which is exactly what vaccine mandates and a vaccine mandate for swine flu would do. These orders for mandates in emergency situations in the state of Texas don't allow for any exemptions. You know, what about if you were going to suffer a bad reaction? Is it possible? Well, let's just look at the FDA having a long history of approving unsafe drugs. Vioxx, Bextra, Zelnorm, Baycol, Xylar, and Palidone are just a few amongst many to trigger your memory. There are many outstanding questions about the safety and efficacy of the swine flu vaccine. It is so new. We don't even know if it'll work. Now, vaccines don't last from year to year for flu vaccines. So what about next year and the year after that and the year after that? What about you young people in this audience? You're between 18 and 22. Are you going to take this shot every year until you're 80, 90? I mean, how many shots are you going to get? You have to think about these kinds of things. Mandating this would be a big mistake. I just want to point out that when Dr. Betz said if asked to volunteer to take a vaccine, only 40 to 50% would get it. Hello, maybe some people don't want it. But, you know, that's not even true in all cases. Actually, in the state of California, the legislature passed a Prevnar pneumococcal vaccine mandate. Got all the way through the legislature. Guess what? Governor Schwarzenegger vetoed it. You know why? Because voluntarily, over 80% of the parents chose to get that vaccine based on their communications with their doctor, and he felt that there was no reason to have to use the force of law since many people were already choosing to get the vaccine. It's not going to stop here. Today there are vaccines being developed for HIV, tobacco addiction, obesity, chlamydia, heroin addiction, and cocaine addiction, just to name a few. Will we wake up one day to find our babies and children viewed as potential fat-smoking, promiscuous drug addicts who will be mandated to be vaccinated with more expensive and exclusive vaccines? Where do we draw the line over who decides? Something has got to change, and that thing is vaccines should not be mandated. Thank you for allowing me to be here. I've enjoyed it.
Thank you, Ms. Richardson. Dr. Betz, your closing remarks, sir?
Well, actually, quite honestly, and I think the 4 people mentioned in the back, we can all say we're from the government and we're here to help, and I think we do. It's I think public health as an entity does a lot that just isn't visible in the community, whether you're turning on a tap and getting clean water or getting protected from vaccine preventable diseases or having to buckle up when you drive. There are many of you in this room that through our efforts in public health are here now that would not have been here if it had not been for those efforts. The problem we have in public health is when we save somebody, when we're really doing our job, all we have to show for it is nothing. That's what we want. I mean, public health, from my perspective, is keeping healthy people healthy. We are very concerned and want to work with any groups that are raising issues and concerns about what we do, so how we can better protect the community. But these mandated laws for like school age vaccinations are done for a reason, and they work. So we're committed to doing this. We also feel that this needs to be done in an active public forum, such as what we have here today. I'd like to say something about seasonal flu, because I keep hearing, well, this H1N1 isn't as bad as seasonal flu. Seasonal flu is bad. In the United States, 36,000 people die each year of seasonal flu-related events. And it translates to about 3,000 or 4,000 Texans. That's the equivalent of the number of Texans that are dying as a result of motor vehicle crashes or homicides. And collectively, seasonal flu causes more deaths than all our other vaccine-preventable illnesses combined. And so when you talk about it's just like seasonal flu, I think that we need to be aware that seasonal flu is not an innocuous thing, that many of us are going to die in Texas as a result of that. I think one of the best spin-offs of this H1N1 situation is that a lot of people who have gone ahead and gotten the seasonal flu vaccine, what they wouldn't normally do, and I think that's going to have a major impact on saving lives. I think we can have these kinds of discussions. I think it's important that we have them, but also keep in mind, I think we're all after the same thing. We want healthy communities. We want our children to grow up healthy and have productive lives. And certainly we're not interested in introducing any toxins or poisons that are going to adversely affect it. These are our kids too. I mean, we have the same goals in life. We want to make this a better community, a better society, and I think collectively one of the ways we do that is by having these type of discussions where we can go back and forth, where both sides feel like they have points to make, and hopefully there'll be some kind of common ground where we can work these things out. But I feel in some ways proud for us to say we're from the government, and I think we do help.
Thank you, Dr. Betz. Dr. Tenpenny.
Isn't it interesting that vaccination requires a debate? Would we even need a forum to discuss an antibiotic or an antihypertensive medication if there was evidence that that drug was causing harm? Officials seem to have almost a desperate need to defend the current belief system around the perceived effectiveness of vaccines. Vaccines are rarely removed from the market, even when tens of thousands of reported side effects, some that are serious, some that are even deadly. Vaccination has been accepted as safe, effective, and protective. The shots can be described as a medical sacred cow, which is a medical procedure that is unreasonably immune to criticism. Doctors and patients who question vaccines are ridiculed and marginalized. It is heresy to say that the status quo just might be wrong. Vaccine adverse events are considered rare, so when reactions occur, steps are taken to negate the association. Patients are discredited, parents are dismissed. Doctors subject very sick persons to thousands of dollars of inconclusive medical tests rather than simply just blaming the illness on the vaccine. Would we do that if a person reacted to penicillin or Paxil or any other drug? The government's view of germs seem to be similar to our current view of terrorism, random attacks that can be deadly. All parties involved in mass vaccinations seem to view infection, particularly influenza and this new swine flu, in that way. Tens of millions of dollars have been spent on national advertising campaigns and even Sesame Street merchandising to convince us that flu shots are necessary to keep us well, even keep us alive. After nearly 2,000 years, fear still sells vaccination. But what do we really know about vaccines? A review of the medical literature and CDC documents reveal 5 salient points. Number 1, vaccine studies and clinical trials are relatively small and only include healthy participants. Once approved, vaccines are given to everyone, regardless of their health condition, their family, or their genetics. Number 2, vaccine safety studies are short. Clinical trials frequently monitor side effects for only 5 days. Reactions to the new swine flu vaccine were followed for only 21 days before the vaccine was declared to be safe for all. These arbitrary cutoffs were set years ago by the FDA and drug companies. Safe is a designation based on limited information. Number 3, vaccine safety studies don't use true placebos. The gold standard in medical research is the placebo-controlled trial, giving a sugar pill to a control group and then comparing the new product for safety. In vaccine trials, the control group is not given an inert substance. It's given a shot, such as a shot of sterile saline. The control group is injected with a vaccine with a known safety profile. This isn't an inert substance. And while this may be acceptable for research, concluding a new vaccine is as safe as a placebo or as the placebo that was given is deceptive science for both the patient and the doctor. Number 4, safety concerns about vaccines are more than theoretical. The U.S. government has awarded almost $2 billion through the Vaccine Injury Compensation Program to injured persons. With vaccines now potentially becoming mandatory for schools and for adults and across the country, the real costs of unnecessary medical workups and the true risk-benefit of vaccines need to be critically overhauled. And number 5, vaccine-induced antibodies do not correlate with protection. The esteemed medical journal Vaccine clearly stated, quote, "It is known that in many instances antibody titers do not correlate with protection." And even the new Novartis package inserts for the swine flu vaccine admits, quote, "Antibody titers that develop after vaccination have not been correlated with protection from influenza illnesses." After 200 years with our many advances in science, you would think that someone could develop a method to protect babies and adults from infectious disease other than injecting them with animal cells, stray viruses, and toxic chemicals. How can this be called harmless? Even more, why do we call this health and prevention? I want to thank everyone that's involved in putting this forum together for the university here at the University of Texas. I want to specifically thank Dr. Betz for doing this. I think this is an amazing thing for a public health official to come and do this debate. I think airing both sides and letting people know that there's a difference of opinion and both people have studied opinions and are very much what you said in your conclusion, that we're both about the best interests of our populations. And letting the people decide for themselves is what our constitutional republic was set up to do. I look forward to continuing this discussion on drtenpenny.com, on Facebook, and hopefully another debate sometime in the future with Dr. Betz. Thank you all.
Thank you. As we come to the end of the forum, I want to thank you all for participating in this very meaningful discussion. I think it was great. I especially want to thank Mr. Pierre de Rogemont for his vision. Raise your hand here. For his vision to have this vaccine education forum and for his tireless work that made it happen. Mr. Rogemont is the CEO. He's the founder of Frontier Nanosystems and for GigaCircuits Incorporated. And he's right, he did have a lot of people helping him set this up, and we appreciate it. Our panelists, I want to thank you, Dr. Tenpenny, Dr. Betz, Ms. Richardson. You've been first rate, absolutely, in articulating your views. The audience has been splendid. I am Dr. Donna Campbell, and thank you for joining us tonight. I look forward to seeing you in the future, and God bless America.